All right. Good morning, good afternoon, good evening, depending on when you're watching this video. This is the voice and the face of Dr. Tolulope Olabintan of Livingspring Family Medical Center, bringing out the vegetarian in you. Yes, you. Without any further ado, I'm going to hand over to Dr. Atkins. Thank you so much for being here. I appreciate you doing this with us. So thank you, thank you, thank you.
Yeah.
And my first question to you would be, please, who are you? What's your name? What do you do? Let our viewers know.
Yes, thank you for having me today. I am Dr. Amanda Atkins, and I'm a board certified internal medicine physician, and I am also the owner of Enlightenment Health and Wealth, where I actually serve as a health coach, and I help women who are overweight overcome their weight and actually help them to prevent and reverse chronic diseases such as high blood pressure, diabetes, and heart disease.
Awesome, awesome, awesome. I like what you do, Doc. I love what you do. All right, Doc, that's awesome what you do. I'm sure those who are listening, either live or in replay, would be excited to know what you do and also would like to reach out to you to see how you could be of help. But my next question to you is this. Why do you do what you do? What led you to kind of venturing out into doing what you do? Yes.
Yes, so it's actually a long story as it goes back to when I was only 14 years old.
Wow.
And yeah, I was actually in gym class and we were having to do these like presidential fitness tests and we had to actually weigh ourselves. And before that time, I never really weighed myself and I weighed 199 pounds as a 14-year-old. And I was like devastated. And I said, there's no way I'm ever going to let a two be the first number in my weight because I was just like, I just can't do it. And so from that point on, it started my journey on my wellness journey. And so I would start exercising to lose weight. And then I actually became a vegetarian at the age of 16.
Oh,
And
wow.
some people are like, why did you become a vegetarian? And like, my cousin was vegetarian, but nobody else was vegetarian. And so I was like, I'm just going to see what I can do because, I just wanted to lose weight. And so I actually was able to lose weight, keep it off. And then as I went on through medical school or residency, I still overweight. And then I actually learned more about nutrition, which we don't get a lot in medical school.
Mm-hmm.
I went to a nutrition conference because I wanted to go to Arizona and go to the spa. So they were given a nutrition conference and a doctor talked about plant-based nutrition. And he actually said, you cannot out-exercise a bad diet.
Oh,
And
wow.
I was like, wow, okay. So I've been exercising all this time, eating junk food vegetarian, I would call it. And from that point on, once I knew that I had to actually change what I was eating to prevent chronic illnesses, and I picked those illnesses that I mentioned earlier, heart disease, diabetes, high blood pressure, because that's what runs in my family. And I was like, I did not want that to happen to myself. And so since I knew that now plant-based nutrition can prevent these chronic diseases or lower my risk for them, then that was keep me on this journey all these decades later.
Wow. That's so interesting. They started out with you. You knew what it felt like to be a certain weight and not necessarily just the numbers, but how you felt
Right.
even having that weight. And that propelled you in your journey. But I love what you said, and I put it in the chat group. You cannot out exercise a diet. You cannot
Yes.
out exercise a diet. I love it. I love it. So you already mentioned, you already answered some of my next question was going to be, or is going to be, how did you get started? And I see that for you, it was the scale. You got on the scale, you saw that, oh my goodness, I've never checked my weight. Wow. And then step by step, you started getting more and more information. You got to medical school. That was good. And yeah, we don't get a lot of nutritional training in med school. And so you decided to do something about that. And so you went for a conference. So you learned about plant-based diets and how helpful it can be in regards to heart disease and diabetes. That's pretty awesome, pretty remarkable.
Yes.
Now, so for some of my viewers who are watching, who are saying, well, good for you. I'm happy for you that you figured this out when you were younger. And sometimes I feel my patients may not relate to me when I say this, because I grew up in a home where when you got the highest grade, you got the biggest papaya or biggest mango or banana. You didn't get candy or cookies. So it was not, sometimes it gets a little confused. You reward people with candy, your kids with candy, but you yell at them, eat your vegetables. So you're passing the wrong message. So I grew up the opposite, where, oh my God, good job. Here's mango. Here's a snack. Here's some carrots. So it was normal, kind of like we didn't have a choice anyway. That's what you got, So how would you say? What would you say to those people who are like, well, I'm happy for you guys, but I didn't grow up like that. We grew up with a lot of meat. We grew up with potatoes. They call it the meat and potatoes guy. We grew up with silent cooking, greasy bacon, and salads and stuff. Still don't understand that. I still this throws me off. But, so what would you say to them? Like what would you say to those who say, I can't relate. I didn't grow up in that way.
Yeah, so I actually left out a part of my story. Like I mentioned that I was all the vegetarian, but I did not mention that my dad was a meat delivery truck driver. So all we really had in the house was meat. So from hot dogs at every birthday party, bologna, fried bologna sandwiches growing up with potato chips on there, that was our jam. Like my babysitter, we would make those and stuff all the time. Like that's it. So it's just because I became a vegetarian at 16 doesn't mean I don't understand people's struggles and how they grew up with just meat and everything. Like that's the center of the plate. Like I definitely understand that. And like I said, I was not the healthy vegetarian. I was more the junk food vegetarian, like going to McDonald's, a Big Mac, no meat, with the front side of fries. Like that was me, at 16, 17, like that was my favorite meal. So I understand the struggle, but like I said, deeper down, I had to figure out why I was doing this. And like I said, it was more for the prevention of the chronic illnesses as I got older. And I wasn't plant-based, like whole food plant-based when I was younger. It actually grew into that like in the last 5-6 years. So I still can relate to people that are struggling with that, and like the meat is everything. And I didn't eat much vegetables growing up, even though I was a vegetarian, right? So just learning those things as you go along, knowing that it's going to be a journey throughout your lifetime. You're never going to arrive. You're always going to be learning new and more things to actually make your health better. So I just encourage people just to start where you are. It doesn't matter how old you are, how young you are. You can start now.
I love that. And I want to highlight quite a few things that you said. Essentially, being vegetarian is not always necessarily plant-based.
Right.
Okay. One has to be very careful about that. Being vegetarian is good in itself, but you have to be very careful. It can be an excuse to eat a lot of bread, right? Cakes, because they're not meat, but they're also not really good for you. Okay, too much white bread, too much white rice, processed sugars. And so one has to be very, very, very careful. And then you highlighted two things. You say, you know what, we're all in a journey, right? No one is ever self-made. You don't arrive the first day. Start where you are. Yes, Yolanda, that is correct. Start where you are. And so for that person who's watching, who's like, well, good for you. I'm not sure I can give up meat. Meat's like my, that's meat is a big part of who I am. Just start where you are. Incorporate more plants. Think about it. Be conscious about it when you go grocery shopping, right? Think about it. If you don't think about it, you're not going to do it. But let's highlight a few things, because I feel that sometimes when patients come to see me and they're like, oh, I say your sugars are high, and they're like, well, I don't feel bad, doc. So why is it a big deal? I don't feel bad. Like, what's your problem? Or the cholesterol. They start medicine, right? Cholesterol is better. And they're like, I don't feel any different. So why is plant-based? And I know you touched on it already, but specifically, if you could highlight maybe 2-3 points, why is a plant-based diet? Why is that necessary?
Yeah, and I want to point out to you that some people say that they don't feel bad until they change what they're doing, and then they realize, okay, I didn't realize I felt bad, because it's a slow kind of thing that comes on. So you're like, okay, I'm a little bit more tired here. I don't sleep well there, or I have a lot of heartburn, or my stomach is like upset at times. Those things that people don't realize that's definitely their diet that's making a difference. And so they don't feel bad until they feel good. Okay.
Right.
So I just want to point that out too. So some things that can actually help when you go plant-based. One, you have more energy. So that was one thing that I struggled with a lot. Like, I am a sleeper till the day, from 2 weeks old on. Like, I still love to sleep. But there were times where I was just like, energy just like dropped by noon, and I'm like, oh, how am I going to make it through the rest of this afternoon and into the evening and all those things. So I noticed that my energy level went higher. I was driving home and I wasn't like trying to fall asleep immediately, my sleep is better. Of course, if you have high blood pressure or high blood sugars, you actually start to see those actually become better and stabilize. So a lot of people, once they switch to plant-based and whole food plant-based, I want to point out, is that they actually learn that they need less medications, or sometimes people don't need any medications at all. So again, a lot of people are concerned about the side effects of medications and how that makes them feel. And I point out to them that your food also is having a side effect. You just don't get that paper printout from the pharmacy. So think about it that way. So everything we put in our mouth has a side effect, whether it's a pill or a Big Mac.
I love it. I love it. I love it. You dropped so many gems, and I want to highlight some of them. One, you talked about sometimes people don't know they're not actually feeling their best till they change their diet. And one of the reasons why I always like to emphasize that plant-based diets are very, 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 very important, because you even start to notice the difference when you eat cleaner. Your body is now, the transition can be a little challenging, okay? And we'll touch more about that later. But when you start to, eat cleaner, your body actually thanks you. You feel better. You have more energy, like you said. Certain disease processes actually start to reverse. You're able to sleep better, right? I had done an interview or a conversation piece asked questions to my non-engineering, so by patients who are in their 90s. And I asked all of them, I said, okay, if you could talk to the younger generation, what would you say? Like, what are secrets to long life? And one of the things they always mention is you have to eat clean. Better. You got to eat fruits and veggies. Those are good for you. And one of them actually said to me, well, I've heard it before. He said, you don't live to eat, you eat to live. So you have to find other things that you enjoy in life that don't have to do with food. And that's a message I pass on often. And you also highlighted the fact that there's a side effect to everything that you put in your mouth, right? Be it a pill and be it a Big Mac, right? I'm going to use that one. That's very, very, very good. What you eat, whatever you ingest could potentially affect you. So the same way you think of medications as potentially causing side effects, and you're like, I don't want to take that because, well, the same thing with the foods you eat, they can cause issues. Awesome. You already alluded to some of the answers to this question, but my next question is specifically, if you could highlight, and of course, we encourage our patients or our viewers to schedule time with your doctors, your primary care doctors, to have those one-on-one discussions. These are definitely not a one-size-fit-all. These are suggestions, and we do encourage visits with your doctor to discuss further. But what diseases, if you could give more examples, would you see, or would you say a plant-based diet has helped reverse or control or manage or treat?
Yes. So like I mentioned already, which the highlights, the heart disease, those are the most studied disease states. Your diabetes, most people think that they have to eat a high protein diet and then cannot eat fruit when they're diabetic. And actually it's the opposite. You want to eat a high fiber, high carbohydrate diet to actually control your blood sugars, or even sometimes reverse your blood sugars. I actually just did a meeting with a OBGYN, and we talked about how people that eat more of a Western diet are at higher risk for having fibroids. So it's now actually moving into the women's health movement. So people that eat plant-based are less likely to have fibroids, which a lot of women in the African-American community have that. So that's another thing. There's actually some studies that show that it actually decreases your risk for a certain type of cancer. So breast cancer, prostate cancer, and colorectal cancers. So that's a big, especially now in our younger African-American men are getting more of the colon cancers. So looking at that, there's some studies out talking about dementia, that how it may help with dementia. So I'm really hopeful for that study and come out, and hopefully that actually does help, so it can actually help our dementia patients where are trying to prevent, because a lot of people that come into my office are asking about that. I'm wondering how they can prevent dementia. We don't have an actual answer. So hopefully that's coming down the works, but it's just so many different things that are in our bodies. And I tell people that these are not different disease states, even though we learn them as different disease states, but we have one body and it's all connected. So anything that we do, like breast cancer, is just not in the breast, but it actually is telling you that there's something going wrong in your whole body. So whatever we can do to change what's going on in our body, which is what we put in our mouth, what we're exposed to. So if we can actually change those things, then we can actually decrease our risk for a lot of illnesses.
Preventive. So what you eat can be preventive. It's an investment in your tomorrow, right? So you highlighted a couple of diseases actually, and I'll add some. Of course, heart disease, high blood pressure, diabetes, very, very important. Fibroid, even women's health. It's tied to what you eat. Cancers, and studies have also shown that with And with patients who are cancer treatments, they're going through cancer treatment, plant-based diet actually help with the recovery process and with the healing process. Of course, like I said, one-on-one with your doctor. Also, dementia is preventive. Also, acid reflux. I've had patients switching their diet is all it's like to fix it. No need for more medicine. So there's so many things that a plant-based diet is good for. Okay, and what are we saying as far as plant-based diet? We're saying incorporate more fresh fruits and veggies, more fresh fruits, veggies, and legumes. The beans, legumes, like incorporate them into your diet. Use it as medicine if you must. All right. So thank you for those highlights. Those are very, very good. Now, my next question for you, and one of the ones I tend to see a lot of is, Doc, I switched over. I started eating a lot of greens, and I've been gassy. I've been burping. I've been farting, and yeah, that's a problem. So, I should better ask it. But they're saying, Doc, that no, I feel worse. You said I was going to feel better. So what do you say to those who are watching, or those who I have the same questions? Like, yeah, doesn't.
Yes. So that definitely can happen. Sometimes it's because the change that we do so quickly, so our body is overwhelmed with the fiber and trying to digest that. But also, like I said, everything in our body is connected. And in our gut, our colon area where we actually digest food, we have like bacteria that's there to actually help. And that bacteria may not be the healthiest. And therefore, when you go to start eating healthy foods, it's trying to digest all those things. And the bad ones are more than the good ones in your gut. And so you're probably going to be producing more of those gases, which can like help with the transition. You will have a little bit of that. But as your body gets used to eating those vegetables, beans, and things like that, and your gut, we call it microbiome, gets better, your gassiness and bloating will actually go away. But again, you go through this transition point where you may feel bad or worse before you feel better. And it's like detoxing from all those bad foods that you were eating before, and your body has to do a reset. So you do have to go through that kind of withdrawal state first, and you'll be happier on the other side, but you do have to go through that valley experience.
I like it. The valley experience is a transition for the better, right?
Yes.
As your body gets used to the new food, right? It adjusts. And the most times, it passes. It passes. That transition phase, your body acclimates. And so be patient with the process would be the answer as you go through the valley experience. I like that. I like that. All right. So the next one, the next rebuttals that we tend to get is, okay, Doc, texture. It's a texture thing for me. Like for instance, the blueberries. Like I tell my patients a lot, eat berries. They're good for you. Blueberries to lower your cholesterol. And they're like, yeah, Doc, I can't do it. The skin of it. So what would you say to those who have texture and taste issues? Oh, no, let's start with texture first. Let's address the texture. What would you say to them?
Yeah, that one was a new one for me. And until I start actually doing my program, that I didn't realize that people had so many texture issues. I'm like, just eat the food. What do you mean? You don't like the way it is. Like,
okay.
So I can say totally, I did not relate to that one at all, because that was never an issue for me. I'm just like, I mean, different foods are going to have different textures. You're going to have to, try different things. You never know. Sometimes you may have to have things a little bit firmer or a little bit softer. And everyone's different. And I come to the point where I don't judge at this point. So it is going to be just a transition, and it may be some of the things that you try that you don't like, or that your mouth, you just can't get into it. And that's okay. That's why there's hundreds and hundreds of different types of fruits and vegetables and beans that you can take in. So it's not like just because you try one in the category doesn't mean you have to throw it all out. So just keep trying different things, and you never will know what you actually like, because I actually was not a big, Brussels sprouts fan when I was growing up, but now that's like my favorite and go-to. Like I make those all the time. My husband requests them all the time. So definitely try different things. Like I said, in your animal products or animal foods, you have very limited amount, whether you have like chicken, steak, fish, turkey. But in the vegetable world, like I said, there's hundreds of different ones. And I'm sure you have not tried every single one to say that every texture is bad for you. So I encourage people to go to the grocery store, your farmer's market, and just try different things.
Awesome. I like that. So I want to highlight some of the things you said, and I echo those sentiments. Number one, mind over matter. It's good for you. Fruits and veggies, a plant-based diet is preventive. It helps prevent cancers. It helps prevent illnesses. So knowing it's good for you is enough for you to eat it, right?
Yeah,
I have this analogy with my patients. I say, sometimes you don't feel like putting on clothes, right? Yeah. You just want to walk out buck naked. Yes, but you understand the consequences that if you did that, you may be taken to a loony house. And so there was a subconscious decision to do what you needed to do. So it was inconvenient. So same thing, fruits and veggies, they're good for you. Inconvenience, yes, but you take them anyway, mind over matter. Number two, there's so many options. And I always recommend people do the try a new fruit challenge, where you go to a grocery store and say what fruit is on sale. And that's what you buy and you try it out, as long as you're not allergic to it, like deadly, so you try it out and say, oh my goodness, okay, this is new. We could do more of this. So that's another way. There's so many options, hundreds and hundreds of different fruits and veggies. Keep trying. You may not like it. And that's the thing even with kids, 1 minute they're like, oh, I don't like this. And the next year, one thing happened one time. My kids, they didn't like a particular fruit. They swore by it. And then we went out somewhere and I was like, oh, they would eat that. They ate it like they'd never seen the fruit before. And I'm like, you guys trying to liar. But yes, give yourself grace. You are capable of changing. Things like frozen grapes can be an easy treat. Try blueberries frozen. Maybe you like it better. Throw it in. If you must drink a lot of ice cream, put some blueberries in it. You're going to eat pancake, put some on it, like fresh ones, syruped ones, the fresh ones. And I also want to caution, sometimes people then say, well, I dip it in sugar. No, please no. Or salt on cucumbers, please no. Please, I just no. So those are what I would definitely, and I know we're making light of this, but these are very, very important. Everybody's capable of change. You and I can't. I've seen introverts become extroverts. I've seen people who would never do a Facebook Live or do a live event to discuss health. We're here.
Right.
So, you are capable of change for the better, change for your health, all in the name of living well and living long. Okay. Because the quality of life and the quantity of life, they're both important. Thank you so much, Dr. Amanda. I'm so happy we had this talk. And I want to give people who are watching live and who will watch in replay an opportunity to know where Doc, if someone is saying, I want to have you come on and answer questions for my crowd, or I want you to come speak at an event, or I want to know how I can reach out to you, Dr. Amanda, where can people reach you?
Yes, thank you for that. So I am on both Facebook and Instagram at Dr. Amanda Atkins, and it's spelled ADKINS, as you can see on the screen, not with a T. And then I also have a website at www.dramandamd.com. And so, you can reach out to me in either of those places. Oh, and I have a YouTube channel. I always forget about my YouTube channel. So it's Dr. Amanda Atkins on YouTube.
All right. Awesome. And what I'm going to do is I'm going to put all that information here in the chat so people can refer to it for later. Okay. But thank you so much for coming. I'm so happy that you were here. This was good. I've learned a lot too. And I know my viewers have learned. All right, guys. Thank you so much for watching live and replay. Please share with those who will find this useful, amusing. And if you or anyone you know are looking for a family physician in the Mansfield area who is thorough, caring, and passionate, I am she. Thank you so much. Have a good one.